Yo, yo, yo. Expose healthcare people. Steve here. So I'm going to do another LinkedIn um, thing. Doomscrolling update. I'm going to go for top three this time. Um, let's see. Ba. Let's look at some medical stuff. So, this is cool. With the national shortage and increased presence of compounded semaglutide in weight loss clinics and medical spas this year alone, there's been a 15-fold increase in reports to America's poison control centers versus 2019. In most of the calls, people reported dosing errors. Oftentimes, it's a person who maybe accidentally took a double dose or took the wrong dose. One instance described a 37-year-old female who accidentally self administered 1 milliliter instead of zero point 0.1 milliliters, 10 times the recommended amount, as her first dose for weight loss. Symptoms commonly attributed to accidental semaglutide overdose include GI related distress and hypoglycemia. These 3,000 cases reported in 2023 so far demonstrate the importance of a pharmacist's role in counseling and education on new prescription drugs. As a medication and drug safety expert, pharmacists can teach injection techniques using the Ozempic Wegovy autoinjector or how to draw up the medication with a syringe and a vial in a few short minutes. Many emergency room and urgent care visits could be spared if this simple safeguard is put into place at all points where medication may be dispensed. Poison Control Center sees 1,500% spike in these types of calls. Yeah, in theory, it'd be nice for pharmacists to explain to patients how to use something. In my practice, I've always sent or directed patients to just look at the YouTube video. It's really good for not only injectables, but any type of prescription that's complicated to use, like an inhaler. Just tell them, look up Ozempic YouTube. That's it. Ozempic YouTube, and the first link will be how to use it. Um, it's interesting that most of the cases with the compounds is just an overdose. Um, it's how much the patient is using. It's not a problem with the compound. There's been a lot of news about the problems of compounds, the impurities in compounds, and then added ingredients and incorrect strength and all that kind of stuff. But it looks like most of the reports are just patient error, which could happen with a prescription product as well. Um, so, all right. Biosimilar webinar slides. Phil Baker, founder at Good Shepherd Health. Great guy. Met him in Nashville. He's doing like basically nonprofit prescription, like pharmacy, but also like redistribution of unused drugs. Um, and he's in a lot of different things, but the long-awaited alternative to Humira, how your planner members can save a lot of money. So he's also helps employers figure out a way to save money using different alternatives prescriptions. Which alternative for Humira is good. Probably should spell check the alternative, but everything else is good. Okay, and last but not least, Kyle McCormick, Mr. Blueberry Pharmacy Man, kicking PBM ass. Don't get your tongue stuck to any frozen, dirty PBMs this Christmas. Wish everyone a happy. Yeah, so this guy's really cool. Helps. He started a pharmacy that's like basically no insurance, cash, cost plus, basically before Mark Cuban did. And he's helping other pharmacies do the same thing. And this is definitely one of the ways to succeed in pharmacy. I did this when I had a independent pharmacy, both on the compounding side, but also on non-compounds. Um, you can really make good money by just charging a fair price on on um, regular prescriptions without insurance. Um, no DIR fees, fair price, nothing crazy, no price gouging, just giving an honest price, which I created in my computer system, like a formula for figuring that out, and you can do that with your EMR. Just be careful with your price codes. Funny story about this. In my pharmacy, so I created this formula for pricing codes. However, because it was linked to the pricing codes of the prescriptions that we're billing through insurance, it actually dramatically decreased our reimbursements from insurance. Um, it's possible a lot of that was offset by DIRs, so therefore our DIR fees were lower, if that makes sense. But regardless, it was not a. Make sure to separate it. If you have any questions, you can message me. So yeah, hope you like this update. Peace.